and it gives me great pleasure to talk about CAR T-cell therapy since I performed the first CAR T-cell therapy in Indraprastha Apollo Hospital. Friends, I am Dr. Ajay Gupta, Senior Consultant in Medical Oncology. I previously had experience of CAR T-cell therapy in Vancouver General Hospital and Children's Hospital, Los Angeles, and it's a living drug, a therapy of promise in the treatment of acute leukemias, myeloma, and diffuse large B-cell lymphomas. So basically, it's a living drug. The T cells of the patient are taken out. So T cells are the policemen, and they recognize the foreign invaders or the tumors and kill them. So the T cells are taken out and they are genetically programmed so that they grow up a new receptor, that is a Chimeric Antigen Receptor or CAR, which enables the T cells to recognize the tumor cells. So these CARs undergo an expansion phase where they multiply and then are injected back into the human body after giving the patient drugs to suppress the immune response against those cells. These cells then multiply in a limited way inside the body and recognize the tumor cells and kill them. So this in effect is known as CAR T-cell therapy, but it is not without problems, and it can lead to cytokine release syndromes, neurological syndromes, and hemophagocytic syndromes. The good thing is that these syndromes are well recognized and are handled expertly by our clinicians, and CAR T-cell is a treatment of the future wherein we expect even in solid tumors many antigens will be recognized and treatments devised accordingly. Thank you.